All right, I remove the oxygen source. Sorry about that, baby. Okay, I take my Q-tip, I dip it in my water. We're on step 12. Okay, I'm cleaning the stoma. So with my non-dominant hand, I pick up the face plate, and I go from I'm working on the side away from me first. Remember when we did bed baths? Remember when we assess things? You always start with the opposite side first, and then on the side closer to you. Okay, so I flip up the face plate, and I go top to bottom in a quarter moon shape. Remember when we were doing moons, top to bottom? Okay, top to bottom, and I throw it away. I get the second one, and I lift up the face plate. I'm using the side closer to me. I do top to bottom, and I throw it away. Okay, so I just cleaned the stoma, cleaned from the bottom up. So the stoma and then the face plate. Okay, we did that. Now we're going to dry. Ooh, that's what these were for. So you will need these, okay, because they're not in the kit. Okay, so you're going to have to dry. Sometimes, if there was enough Q-tips, you can use Q-tips to dry. So get one of these. So you're going to need to dry. So at this point, I get these. I'm not opening these now. These would be opened up in the beginning. And I'd probably put them here. So let's review the setup. The kit, the trach, inner cannula, the Q-tips, the Velcro, and I would have this here. And now you're going to say, but aren't you going over your field? I can go right through here. I'm not using this really anymore from my field, am I? You know, so we're going to dry. Okay. I like to make a square 1 by 1. Okay, they should make 1 by 1s in here. Okay, watch, dry. I just went away from. You're not going to go back and forth. Okay, and she said pat dry. Okay, pat dry. I can get another one, and I would pat dry. Done. All right, we're now up to step 14. So you clean the stoma, then stoma. You'd clean the face plate. That's what I would use these for. Face plate. Then I would pat dry it. Okay. Now I'm going to apply the fenestrated. And at this point, there will be extra ones on the cart for you. Okay. You have to kind of flip this up a little bit to get your hand under there. Okay, so we have now the dressing, and that's called fenestrated because it has a split. All right. Now we're going to change the Velcros. This is probably the toughest part of this whole skill. No kidding. You can see this comes apart. No matter if you're in the hospital, nursing home, home care, in the lab, take it apart and set it how you want to use it. Don't depend, like if it's here, you know, how do I know that's in the right position? Set the field up, take care of the equipment how you want for your patient. So I'm going to start off like this, okay, and then adjust it. Okay. It has to go, let's see, it's going to feed through, go like that. Yeah, it has to go. I just want to show you. I'm going to feed it in through here, so when I connect it, it goes on to the white. See how I did that? The old ones stay on until you have the new ones on. Okay? So get some kind of system. Is the old one going to be moved up like that, or are you going to have it down like that? You see how I did that? Is this going to be the old one on top and the new one on the bottom? It's up to you what you want to do, but you don't get confused which one is which. Does she have a preference?
She didn't say.
She didn't say. Okay. I like to do mine away from first. It's just easier for me. Let me see, so this has to go like that, okay. Maybe not, okay. Have to make an adjustment. I told you, this is the hardest. I used to be able to do ties much easier than these Velcros.
Maybe if you cut the top of it off a little bit, just to make it.
Well, there's
so
a
it's,
tip on it from use.
Oh, okay.
A fuzzy's on there that's preventing it. Okay. There we go. I'm choosing to keep my new one on the bottom. Okay. I like to work away from me first, but however, it's not happening. Okay, you can see a little long, right? Little long. So at this point, just adjust it. So for the mannequins, it's about like that on this mannequin's neck. And do you have this much flexibility in a real trach? Somewhat. You do. Not taking my new one off, my old one off yet. I'm first making sure the old one is secure. I can put 2 fingers, 1 to 2 fingers underneath. Now I remove it. Remember, when you're doing anything on the trach, the priority, trach stays in and your glove never goes over the opening to the trach. Don't forget the patient's breathing here. If if your gloves, mine are fairly tight, wouldn't you say? If they're a little baggy on you, they could breathe and suck a piece of your glove to occlude it. Just be cautious. Keep your hand away from that opening. So now I got, this would get thrown away. I'm checking. See how I'm checking? See how I'm checking? I'm holding the faceplate down. All right? I apply the oxygen source. I reassess lungs, anterior, posterior. I talk with the patient. I'm looking at their color. I'm looking at their lips. Hey, I'm doing capillary refill. Maybe I'm looking at the SpO2. You're putting that whole piece together, all those skills together. I keep the patient up in the semi-Fowlers. I lower the bed in the lowest position. I put the side rails up. I hand them the call bell and go and document. Take everything off and document. Okay? Questions? I think this is a skill where you're really getting just the foundation. When you really see a trach in action, have any of you seen trachs lately?